Hey everyone, welcome back to part 19 of our 100-part CPC exam series explainer. Before we dive in, make sure to like, share, and subscribe to Decode Healthcare with Harshal. All right, picture this: a 35-year-old patient comes in for an annual checkup. The provider jots down HIV positive, asymptomatic. So, how do you code it? Are we looking at B20 or Z21? It's a classic exam trap, and by the end of this explainer, you're going to know exactly how to beat it. Today, we're decoding the highly specific chapter guidelines for certain infectious diseases and neoplasms. These rules, they're absolute game changers, and mastering them is going to make sure you don't lose easy points on test day.
Here's our roadmap for today. We're going over chapter-specific guidelines, tackling acute versus chronic infections, decoding that tricky HIV rule, breaking down neoplasms by behavior and site, and separating active cancer from history. Stick around for a visual cheat sheet at the very end.
All right, let's jump right into mastering chapter-specific guidelines and decoding that tabular list.
You know, the ICD-10-CM isn't just a game of blindly hunting for a word in the alphabetic index. It's really about applying specific rules that can completely override general logic. Think back to the SAFE workflow. Step 3, verifying in the tabular list, is absolutely crucial. That's the checkpoint where we catch all those sneaky chapter-specific traps, like excludes notes and mandatory sequencing directions.
Moving right along to infections, specifically acute versus chronic, in categories A00 through B99.
When you're navigating the certain infectious and parasitic diseases chapter, your coding literally hinges on slight, tiny variations in clinical wording. We've got to differentiate between acute infections, the ones with a sudden onset that are often pretty severe, and chronic infections, which are those persistent, long-term conditions. They're entirely different codes depending on this timeline, so you have to rigorously parse the provider's documentation. Don't just skim it.
Next up, the HIV toting rule, and how to escape the notorious B20 trap.
So let's bring it back to that high-stakes scenario we talked about at the start of the explainer. The line here is drawn very, very clearly. Code B20, that is strictly for confirmed symptomatic HIV disease or an HIV-related illness. Z21, on the other hand, is only for asymptomatic HIV-positive status. So resolving our opening tension, our 35-year-old asymptomatic patient definitely gets code Z21. Instinctively slapping on B20 just because you see the letters HIV is exactly where most test takers lose points. Don't fall for it. Oh, and a quick, vital reminder on excludes one notes. Not coded here literally means those two specified codes can never, and I mean never, be used together on the same encounter. So trying to combine an asymptomatic code like Z21 with a symptomatic code like B20, that's going to give you an invalid combination every single time.
All right, let's shift gears to neoplasms, decoding behavior and site in C00 through D49.
Navigating this chapter is like solving a puzzle, and it depends entirely on tracking two things: the exact anatomical site and the behavior of the tumor. We classify these by behavior. Malignant primary is the original site of the tumor. Malignant secondary is where the cancer has spread or metastasized. And listen, that changes the code category completely. Then we have in situ, benign, and uncertain behavior. Grasping this primary versus secondary site sequencing logic is, well, it's absolutely critical for passing the exam.
Next, we need to talk about active cancer versus history, because timing is everything.
This right here is another major exam trap, distinguishing between a currently active malignancy and a historical one. An active neoplasm means the patient is currently undergoing treatment or observation. You must only use the personal history Z85 codes after the complete and total eradication of the malignancy, never before. If they're still receiving treatment, it's still active, period.
Speaking of treatment, if the patient is there solely for a dedicated treatment encounter, you need to follow these exact steps. Step 1, code the therapy encounter first. That means sequencing your Z51.11 for chemo, Z51.12 for immunotherapy, or Z51.0 for radiation as your primary code. Step 2, then you sequence the active malignancy code second. It's a simple 1-2 punch.
Okay, time for the visual summary cheat sheet. Screenshot this.
Seriously, get your screenshot buttons ready, because this single page pulls together everything we just decoded. Here's your rapid-fire review. HIV asymptomatic, Z21. Symptomatic, B20. Always respect the excludes one note. Never code mutually exclusive conditions together. Neoplasms require strict primary versus secondary site logic. Eradicated cancer? Go with personal history Z85. And for an active treatment visit, sequence your Z51 chemo or radiation code first and the cancer second. These are your ultimate tools to beat the CPC exam.
Coming up in Part 20, we'll be tackling chapter-specific highlights for endocrine and diabetes, circulatory, and injury and poisoning rules. You definitely won't want to miss mastering those complex rules with us next time. To wrap up, I want to leave you with this provocative thought. When you look at a patient's chart, are you coding their active disease or just its history? Precision in your documentation changes everything. Keep studying hard, and, once again, make sure to like, share, and subscribe to Decode Healthcare with Harshal. See you in the next explainer.